Okay, so I'm going to show you then how we finish off a subcuticular stitch, and usually we end up closing the wound with what's called an Aberdeen knot, and you need to get a subcuticular bite but as close to the corner as you can. Pull the suture through, and now you're going to end up with essentially a loop such as this. And what you need to do is to essentially grab the loop between your forefinger and the thumb and push the long end in and grab the stitch with your forefinger and essentially pull through, and that gets the knot down. And when you get the knot in, you feel the tension on there. Again, between your forefinger and thumb, grab, pull through. One more time, grab, pull through. This puts 3 knots on there, and the closure then finishes by pulling this through. So this knot is now finally locked, and this is called an Aberdeen knot. It's locked, and that you normally have more tension on that knot as a closer. I'm not going to pull it through too much because it will tear out, because it's not as tough as normal skinning. And then lastly, once you've done that, you essentially find the corner and push the needle right the way through. You want to push it along the wound edge, so you usually a few centimeter away from the wound edge. You pull that through and you ask your assistant to essentially cut that flush with the skin. Don't worry if that leaves a little bit behind. Ordinarily what will happen is as the skin relaxes, that will pop in. In fact, that's exactly what should happen at the end. There should be a little bit poking through. Otherwise, if you cut it too short, the end will pop out at the end of the wound.